Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I am thrilled to welcome renowned double board certified psychiatrist, educator, international lecturer, and New York Times bestselling author, Dr. Daniel Amen. Dr. Amen is widely regarded as one of the world's foremost experts on the application of brain imaging science to clinical practice and human behavior. Good morning, Dr. Amen. Thank you so much for joining us. It is such a privilege to have you sitting in that chair this morning.
Thank you.
So why don't we go back to your earlier years? What initially inspired you to study medicine?
Well, when I was 18, the government still had a draft, and it's actually a funny story. So I had to go sign up, and I had a very low draft number, which meant that I was probably going to be drafted. And at the time, I wanted to be a veterinarian, and they had a program to be a veterinarian's assistant, and so they lied. So I decided to join, and I came home and told my dad that I was going to do this, and he said, there's a war on, Vietnam was still going on, you can't join. And if he would have just said, let's talk about it, I would have talked about it, but I made this stupid comment of, I'm 18, I can do what I want. 3 weeks later, my head is shaved, and I have people yelling at me, calling me a maggot. And I'm like, how did that happen? But it was really, so they lied, and I ended up being an infantry medic, and that's where my love of medicine was born. But I realized about a year into that, two really important things about myself. I hated sleeping in the mud. That's sort of just not me.
It's a great thing to find out.
It's not me. And I couldn't get used to being shot at. It just upset me. And so I got myself retrained as an X-ray technician, and that's where I developed a passion for imaging. As our professors used to say, how do you know unless you look? And that ended up to become one of the major themes of my life.
So fast forward to psychiatry. What initially inspired you to go and focus your medical education on that area?
So I thought I was going to be a pediatrician or an imager, and when I was a second-year medical student, someone I loved tried to kill herself, and I was horrified. And I took her to see a wonderful psychiatrist. He was chairman of the Department of Psychiatry where I was going to medical school. His name was Stan Wallace. And I just fell in love with him. I knew if he helped her, which he did, it wouldn't just help her. It would ultimately help her children and even her grandchildren, as they would be shaped by someone who was happier and more stable. I fell in love with psychiatry because I realized it has the potential to change literally generations of people. And every year since then, I've been in love with this specialty. Now, I've also been at war with this specialty, which we'll talk about. But I remember it was 1980, and my dad, so he's obviously an important person in my life, when I told him I wanted to be a psychiatrist, he asked me why I didn't want to be a real doctor, why I wanted to be a nut doctor and hang out with nuts all day long. Literally, that was the discussion. And it hurt my feelings. It's like, what parent does that to their child? But I get where he was coming from, that the diminishment and the stigma associated with being a psychiatrist and seeing a psychiatrist is our own damn fault, because we don't act like medical doctors. We are the only medical doctors that virtually never look at the organ they treat. And that's crazy. And that's been part of my own personal war that I've been involved with for a long time.
So tell me how you came to stumble upon the beneficial
science of the SPECT scan and where that came in within your practice?
So I was an X-ray technician before I went to medical school. So how do you know unless you look? But yet I'm a psychiatrist and they're not looking. And so I agitate my professors. And I trained at a really great place, the Walter Reed Army Medical Center in Washington, D.C. It's this huge premier military hospital. And MRIs and CTs had just really become popular. And I'm like, well, we should use those. And they go, not ready. I then became a child psychiatrist. And after I finished that training, they sent me to be the chief of psychiatry at a little place in the Mojave Desert called Fort Irwin, where they train soldiers to fight the Russians in the desert. And it's an isolated assignment. And when I got there, I'm like, so what do we have to help our soldiers? And we had an old autogen biofeedback temperature trainer. And I had one lecture on biofeedback in medical school. And as I learned about it, I loved the idea of skills, not just pills. So that had been another sort of phrase in my head. And I wrote the Army a proposal to get state-of-the-art biofeedback equipment for Fort Irwin. And eventually they approved my proposal. And then I learned about neurofeedback. And this is like 1987. And I'm like so excited about it. So we brought biofeedback to Fort Irwin, including neurofeedback. And as part of neurofeedback, I learned about a study called quantitative EEG. So looking at the electrical activity in the brain. And so I'm like a little kid. I'm looking at the brain, I'm changing the brain, and I fall in love with it. In 1989, I got out of the Army, started our first clinic in Northern California. And we were doing quantitative EEG, loved it. But in 1991, I went to a lecture on brain SPECT imaging given by the chief of the medicine at the hospital where I was working. And it changed everything. Because with EEG, you're looking at electrical activity from the scalp in, as opposed to SPECT, which is a nuclear medicine tool where you put the medicine in someone's arm. So you really get a look from the inside out. And I've got these beautiful 3D pictures of brain function for my patients. And so I actually like both studies, but SPECT was so much more powerful, and you could see deeper structures in the brain. I was just hooked. And I think, and people hate when I say this, right, that there's a spiritual aspect to this, because my first 10 cases, I remember every detail of them. They were transformative. That
your first 10 cases that you applied SPECT scanning?
SPECT to.
Okay.
Right. That one woman was diagnosed with Alzheimer's disease. She'd almost burned her house down. Her daughters were completely besides themselves. They're going to put her in a home. She doesn't want to go in a home. There's a huge family fight. They go, well, let's put her in the hospital and one more evaluation. And by random chance, if you believe in that, she gets assigned to me. And I'm like,
let's do a SPECT.
Looks like she has Alzheimer's to me. I mean, her symptoms were very consistent with it, but I said, I'd never give someone that diagnosis unless I looked at the function of their brain. And when I looked at it, she didn't have the pattern, which in 1991 had already been described in the literature. And she didn't have the low activity. Her emotional brain was stirred up. That she had this thing we call pseudo-dementia. And on Wellbutrin, a really good antidepressant, 3 weeks later, she has her memory back.
Extraordinary.
And I'm like so excited, because like most people go into medicine, I went in it because I like helping people. That's what makes me happy. It makes me excited when they get better. And what I found is people who weren't getting better, once I had the image, they got better at higher numbers and they got better faster. So I was happier.
Now, how come SPECT imaging was not used on a broader level? How come there's been so much criticism over the years?
So in 1992, I went to an all-day lecture on SPECT at the American Psychiatric Association. So early on when SPECT came out, there was a lot of excitement about it. But The researchers complained it wasn't a clinical tool, so I got hit for that because I was using it clinically. And it didn't correlate with the diagnostic Bible of psychiatry, which is the DSM, the Diagnostic and Statistical Manual. So if you take 100 people with depression, you're not going to find one pattern. With SPECT, you're going to find 7 or 8 or probably 10 patterns. And they go, oh, well, imaging's not useful. And I raised my hand and went, no, your diagnostic Bible's wrong. But, you know, when you tell people they're wrong, they generally are not very happy with you. Because if I'm right, and I believe I am, what we're doing as a specialty is wrong. That we're actually hurting people because we're throwing darts in the dark at them. And so the critics will say there's not enough research. And my response is go to PubMed.com today, type in brain SPECT, you'll get 13,903 abstracts. There's a huge literature. They go, well, most of it's from you. And I'm like, no, that's not true. We published 80 studies. Most of it's not from us, right? And it's widely accepted for head trauma, seizures, strokes, dementia, and toxic exposure on the brain. Well, if psychiatrists just ordered it for that, they would be ordering them on a lot of patients because some of the big lessons I've learned is things like mild traumatic brain injury are a major cause of psychiatric illness. But most psychiatrists don't know that because they don't look. And so throwing darts in the dark at people, it's just wrong. And we can do better.
Do you have a lot of stab wounds in your back?
I have a lot of arrows in my back, but a long time ago, I realized I'm in this fight for a reason and I can handle it.
So let's talk about treatment protocols for various brain disorders. We are here at A4M, you know, we look at the root cause of a disease. We like to treat with integrative approaches. So what are some of the things that you do in your personal life and that you recommend to your patients outside of the pill for every ill?
So in 1991, when we started doing scans, I scanned everybody I knew. I scanned my kids, I scanned
you scanned your wife on a date, actually. We'll get back to that story, but...
well, that's later.
Okay.
That comes up later. But I scanned my mom, and she had just a gorgeous brain. And it really reflected her life. I mean, even, she was 60 at the time. She's 86 now. She's got 7 kids, 22 grandkids, 22 great-grandkids. She knows everybody's birthday. She's everybody's best friend. She's just an awesome human being. But then I scanned myself, and it wasn't good. I was really unhappy with it.
And this is 23 years ago you did this?
It was 27 years ago.
Oh, wow, okay.
And I was horrified, but I'd played football in high school. And I had meningitis twice as a young soldier. And I didn't love my brain. Here I am, a double board certified psychiatrist. And I don't care at all about my own brain because you can't see it, right? I mean, you can see the wrinkles in your skin or the fat around your belly, and you can do something when you're unhappy with it. But because nobody looks at their brain, nobody sort of knows healthy, not healthy. And so it was really that moment I developed a concept I love called brain envy. I wanted my mother's brain. And so I always say Freud was wrong, right? If you understand Freud and psychoanalysis had this concept of penis envy, which actually I've never seen once in my 30-some years as being a psychiatrist. Never seen it once. What we really need is we need to start caring more about our brains. And so I think everything I've done since that moment is, well, how do I have a better brain? And so I'm fairly, if you talk to my family, I'm fairly obsessed with wanting a better brain, which means I eat right. I walked 9 miles yesterday.
What does that mean, you eat right? What don't you eat?
Well, I don't eat sugar. or foods that quickly turn to sugar. I don't eat processed foods. I eat a lot of vegetables, some fruit, high quality protein, and a lot of fat.
How about gluten?
I don't eat gluten. Now, I don't think I'm actually sensitive to it, but I don't see the upside. Plus, I'm really close with Dr. Perlmutter, and he just thinks it's bad for everybody. And so, why? If there's no upside to it, and here's a concept that I think you'll like. I only love things. I only love people, and only love food that loves me back. So I don't know if you've ever been in a bad relationship, but I was in a bad relationship. My first marriage was terrible, and I'm persistent, so it lasted for 20 years. I'm not going to do that again. I am only going to be in love with people who love me back. And I'm damn sure not going to be in love with food that doesn't love me back. I only want to eat things that I like, right? I mean, I love what I eat, that serve my health rather than steal my health. Because I love my wife, I love my kids, I love my grandbabies, and I love my mission. And why would I give it up? Why would I make bad decisions that would hurt me unless I'm sort of an idiot?
Have you rescanned your brain?
I have.
And?
A bunch of times. And it was better the first time, and it was really better the last time. And that makes me really happy.
So what supplements are you taking, and what do you recommend to your patients?
So I take vitamin D, and when I first tested my level, so normal's between 30 and 100, optimal I think is 50 to 100. My level was 17. I was horrified. And there's research that under 20 compared to over 40, you have double the risk of cancer. So I take vitamin D. I take 7,000 units a day. And that keeps me right at about 80, so I'm happy. I take multiple vitamin, even though I have a very good balanced diet. I just think of it as insurance. And I take fairly high dose of omega-3 fatty acids. Balance between EPA and DHA. Most people don't know. People go, oh, brain, DHA, one of the major components of omega-3s, and the brain has a lot of it. But EPA has been found to be more helpful for depression and more helpful for ADD. And at Amen clinics, we see a lot of people who have ADD. So I like a 60-40 blend of that. I also take CoQ10, take some magnesium.
So you referred to, and I've read before that you have said what's good for your heart is good for your brain. Is that correct, or am I misquoting?
So I've actually expanded it a little bit. So your brain uses 20% of the blood flow in your body. So even though it's only 2% of your body's weight, it uses a lot of blood flow. So whatever is good for your heart is good for your brain. And then about 10 years ago, I wrote a book called Brain and Love. And then I realized, oh, whatever's good for your heart is good for your brain, is good for your genitals, because it's all about blood flow. And did you know that 40% of 40-year-olds have erectile dysfunction? Which means 40% of 40-year-olds also have heart dysfunction, vascular dysfunction, and they have brain dysfunction. Because if you have blood flow problems anywhere, it likely means they're everywhere. 60% of 60-year-olds have erectile dysfunction, 70% of 70-year-olds have erectile dysfunction. And I'm sort of not okay with this, especially if there are things I can do to change that.
And if you deal with the brain envy, you could help the penis envy, and then everything else is okay.
And it's one of the most common things. I love that. Thank you for that.
You're welcome.
I'm going to steal that.
Go for it.
One of the most common things my guys tell me is that when they get on the program we give them, their sex lives get better.
We may not have to, forget it. I was going to say we may need to have you back for a second episode of this to touch on that. No pun intended. Okay. So let's fast forward. Yeah, okay. My eyes are tearing right now. So to change the subject a little bit, or a lot, let's go back to when you had your 4 children. I read, ironically, that 3 of your 4 children suffered from ADD. I mean, first of all, the odds of that happening, I mean, here you are a psychiatrist. You then came to specialize in that disease. But tell me, I know you're a spiritual man. I read that things were so bad with one of your children that you would tie her shoelaces together. Is that correct? So she wouldn't get out of her stroller during church?
So I adopted my first son. He was from my first wife's first marriage, and very smart, but not motivated. And it used to really upset me. And a half an hour of homework would take him 2 hours to do, with his mother fussing with him. And it was just this chronic stress. And but I didn't know anything about ADD at the time because I was a medical student. When I got the QEEG, he was one of the first normal kids. We studied, he totally had an ADD brain. He had slow frontal lobe activity. And I'm like, oh. But I adopted him, so I think I'm genetically free of this thing, because it's a genetic disorder. No question, there are genes associated with it. And my second child seemed fine. My first biological child, Brianne. And Caitlin was hyperactive from before birth. She was so active inside her mother's womb, we thought she was going to be a boy. Well, she wasn't. When Brianne was a year old, she'd sit in my lap, we'd watch Beauty and the Beast or whatever was on TV at the time, and it was just really a great bonding experience. Caitlin, she's like not sitting in your lap, she's crawling on your head. At night, she'd always constantly get out of her crib, get out of her crib. I had to like put a net over her crib and zip her in at night because she'd be shaking in the crib. And she was so busy that when you're Catholic, you take children into church with you, which is so stupid. It's just the dumbest thing. And she was so disruptive that I would like take her out and talk to her. But I felt terrible about this, go to church and get your life threatened. That's going to happen to her spirituality. And I used to write a column in the local newspaper where I lived, and so people recognized me when I go to the mall. Oh, you're Dr. Amen, I love your column. And she would have been one of those kids on a leash because she's always running away. It's like, where are you going? And so, because I couldn't put her on a little yellow leash because I'd have been too embarrassed, I used to put her in a stroller and tie her shoes together so she couldn't
Brilliant
get out.
idea, by the way. Right.
So 30% of 3-year-olds look hyperactive. Only 5 to 10% of 4-year-olds look hyperactive. So I waited until her 4th birthday. And then I took her to a friend of mine to evaluate her who said she has ADHD and oppositional defiant disorder. Caitlin's first word was no. Her first short sentence was no way. Her first long sentence was, you can't make me do it.
Wow.
So she was like really clear. The third one though
And you went on to have a third one.
The third one was a surprise in that Brianne, my second one, always easy, always sweet, was incredibly bonded to her. But the truth is, and this is going to sound terrible, but it's the truth. I love a verse in the New Testament from John 8:32, know the truth, and the truth will set you free. I didn't think this child was smart, and that hurts me deeply to say that. But I didn't. I had to teach her things over and over again. I'm like, why is she not learning? Why is her memory not good? And I took her to the same psychologist who basically said, Brianne's okay, but she's not that smart. Now, she didn't use those words, but I saw the testing. But she said, Brianne will be okay because she cares so much and she works so hard. And that, in 8th grade, she won a Presidential Scholar Award, not for academics, but for effort. Schools can give one of those a year. And I mean, how do you not adore a child like this? But in 10th grade, she completely fell apart. She was staying up every night till 1 or 2 o'clock in the morning to get her homework done. And one night she was studying genetics of all things, and she came to me in tears. It's 1 o'clock in the morning, and she's like, I don't understand this, and I can never be as smart as my friends. And it broke my heart. And so I scanned her the next day, and I cried when I saw it because she had a classic ADD scan. And I'm like, she had what we call inattentive ADD. So, like, depression isn't one thing, ADD is clearly not one thing. And I said, I want to put you on medicine and rescan you tomorrow. And she said,
day?
Medicine, I'm not going to take medicine. I'm not like Caitlin, because those two had been in war ever since Caitlin was born, because Caitlin was conflict-driven, which is common in many ADD kids. And Caitlin's now a mom, and I adore her, and she's an awesome human being. But I convinced Brianne to do it the next day on 1 dose of Ritalin, normalized her brain.
Oh my goodness.
And now, Brianne lives in the house of a child psychiatrist who specializes in ADD, and I missed it. 3 months later, straight A's. First time in her life. I mean, I don't ever remember her getting A's. It was always B's and C's with a lot of effort. Straight A's. And I remember a week on the medicine, I took her out to dinner. I'm like, so how are you doing? She's like, Dad, it's unbelievable. I said, what do you mean? She said, I think I'm going to be a geneticist.
Oh my goodness.
I'm like, what? Because a week earlier, she was crying about she can't understand. She said, Dad, I can see the DNA molecule rotate in my head in 3 days. And I used to hate school, but now I love school because I can do it. And the next 10 years, straight A's. She actually got into the University of Edinburgh's veterinarian school. It's one of the best vet schools in the world. If I wouldn't have scanned her, I would have been complicit in condemning her to a life of mediocrity.
And I'm sure there's been many stories like that of patients that you have helped over the years, and it has to be incredibly gratifying. I know that.
Well, that's what helps with the war.
I'm brought to tears, right?
It helps with the war, right? So when my colleagues say, it's funny, 2020 came and interviewed me, and they did. They were going to do a got you interview because they lied about the reason they came, and the reporter starts with, Brad Peterson from Columbia, who's a child psychiatrist imager, says you should be arrested for what you do. He starts the interview like this. And thank God I was on the speech team when I was in college. So I can do extemporaneous responses. So I took a breath and I said, wow, I said, that's really interesting. Last week somebody told me I should win a Nobel Prize for my work. This week you're telling me I should be arrested. It sort of keeps me balanced.
So how many bestsellers
Dr.
later?
Peterson and I are actually doing research together.
Fascinating.
So make friends is one of the things, right? Collaboration is good. And when people criticize me, I often think they're either jealous or they don't know. Because if you don't look at the brain, what's the matter with you? That's not medicine, it's not science, it's stupidity.
Okay, let's talk about your talk today. So you have this incredible new book out, Memory Rescue, bestseller. You have another one coming out in November, correct?
Feel better fast and make it last.
So today you'll be speaking on the memory and brain, and do you care to expound on what you're speaking about?
So most people don't know that if your brain is headed to the dark place, you can do something about it. And So memory rescue is in many ways based on the NFL work that I've done. So, and I don't know why I bring trouble upon my head, but
you started working with doing the NFL work before the NFL would even admit that there was any.
Well, actually, they formed their concussion committee in 1994, but they never did a brain imaging study on humans. Instead, literally, they studied rats. They put little tiny helmets on rats, whacked them in the head
Sent them down a
repeatedly,
football field?
threw them down laundry chutes, and put them in dryers, and autopsied their brain. And Roger Goodell in 2009, in front of Congress, says, we don't know if playing football causes long-term brain damage. We're studying the issue. And Maxine Waters, the congresswoman from Los Angeles, smacks him metaphorically and said, Commissioner, having you act like you're studying traumatic brain injury in football players is a conflict of interest. It's like the tobacco companies saying they're studying lung cancer. In 2007, Anthony Davis, the Hall of Fame running back from USC, came to see me, and at 54, his brain looked terrible. It clearly had a traumatic brain injury pattern. And on our work, I published Change Your Brain, Change Your Life, my biggest book, in 1999. I mean, we've been talking about changing people's brains for a long time. And a couple of months later, he's much better. And his brain's better. And he's like, Doc, we have to tell people about this. And so he invited me to the Los Angeles chapter of the NFL Players Association. And we decided to do a study and study players. We've now scanned over 200 players. 80% of our players show improvement in as little as 2 months when we put them on a rehabilitation program. So the idea behind memory rescue is you want to keep your brain healthy. See, it's good if you just want to keep your brain healthy, or rescue it if it's headed for the dark place. You have to prevent or treat the 11 major risk factors that steal your mind. It's an integrative medicine approach.
So what are they?
To brain function. So I created a mnemonic to make it super easy to remember. It's a memory book, right? So, and the mnemonic is called Bright Minds. So B is for blood flow. Low blood flow is the #1 brain imaging predictor of Alzheimer's disease. But most people with memory never get a functional imaging study. And so I think we should, if you have Alzheimer's disease in your family, you should get a scan at 40. I think all of us should be scanned at 50. When I turned 50, my doctor wanted me to have a colonoscopy. I looked at him and I said, well, why don't you want to look at my brain? Isn't the other end just as important? So how would you know if you have low blood flow if you don't get a scan? Hypertension, any form of heart disease, if you're sedentary, if you have erectile dysfunction. So what can you do about it? And the book is all based on how do you know if you have it and what can you do about it? Ginkgo, vinpocetine, beets, rosemary, cayenne pepper, exercise, especially coordination exercise. People who do coordination exercises, tennis, table tennis, dance, squash, they live longer than everybody else. So, and that's because it activates the cerebellum. It's a whole different topic. R in Bright Minds is retirement and aging. When you stop learning, your brain starts dying. The biggest risk factor for Alzheimer's disease is age. And I've heard a lot of people say, well, I'm 60, I've been so focused on my body and my weight, I'm done with that. And I'm like, well, as long as you're okay with the consequences, right? Which is depression and dementia. I think the older we get, the more serious we need to be because we have less reserve. The I in Bright Minds is inflammation. And here at this conference, everybody knows that inflammation is a major cause of depression and dementia. And so I like to measure C-reactive protein, but also your omega-3 index. I just published a study last year, low omega-3 index, low blood flow to the hippocampus, the major memory structure in the brain. Interesting, brand new study. Older people, so I'm 63, we make as many new cells in our hippocampus every day as younger people, but we don't get to keep ours. Why? Because we have low blood flow. So working on blood flow helps me. So hippocampus is Greek for seahorse. So in the book, I talk about you have all these baby seahorses. Are you murdering them, or are you putting them in an environment where they can grow and thrive? So I take care of my seahorses. Another major cause of inflammation is gum disease. And until I realized that, I just didn't care at all about my gums. They weren't important to me until I saw the connection between gum disease, inflammation, heart disease, and dementia. And now I'm like flossing all the time, and when my dentist says I have good gums, I'm so happy. The G is genetics, and many people think of genetics as a death sentence, and it's not a death sentence, it's a wake-up call. If you have the genes, it means you need to be more serious about preventing everything else. And the genes increase the production of beta amyloid plaques, which are one of the things that causes death in the brain, although it's very controversial. I publish most of my recent studies in the Journal of Alzheimer's Disease, and the editor there thinks the amyloid hypothesis of Alzheimer's disease is dead, or at least should be dead, because amyloid is a protective protein, and often it's going to protect your brain from toxins or infections or other reasons that you're getting dementia, which we'll see in a minute. So anyways, genes are really important. But if you want to break up beta amyloid, curcumins do it, vitamin D does it, green tea does it, blueberry extract does it. I mean, there are all these sort of natural ways. And all of the amyloid reduction drugs haven't worked. In fact, many of the big pharmaceutical companies are getting out of the Alzheimer's business because they've spent billions on trial after trial of drug failure. But you know what Bright Minds teaches us, it's not one road to Alzheimer's disease, so it's not going to be one medicine that gets us to a cure. You have to attack the war on multiple fronts. And in Bright Minds, 11 makes perfect sense to me. The H is head trauma, a major cause of Alzheimer's disease that very few people know about. And our NFL work was very clear. Actually, the NFL's own study, if you're under 50, you have a 19-fold increased risk of being diagnosed with dementia if you played professional football. After 50, you have a 7-fold increased risk. There's a risk. Your brain is soft, about the consistency of soft butter. Your skull is really hard and has sharp bony ridges. Shaking it repeatedly, Brett Favre was just on the Today Show yesterday, and he said he had thousands, probably tens of thousands of subconcussive blows. So we have to be more protective. You should not let your children hit soccer balls with their head. Are you stupid? I mean, when you understand the physics, and it's worse for girls. Why? Because 90% of IQ for females is housed in their prefrontal cortex, where for males it's more widely distributed. So for her, repeatedly hitting something with her forehead is just a bad idea. Now, it's a bad idea for boys, worse for girls. We need to do a much better job of protecting. And my brother, I've had people in my family who make fun of me. My brother, when I started the NFL work, he's like, great, you want everybody to play table tennis. Because I play table tennis and played in the U.S. Nationals 2000, so I play at a high level. And
T.
I'm sorry?
T. Bright.
Oh, bright, T, sorry. I'm getting off track. T is toxins. Another major cause of psychiatric illness. People think of alcohol as a health food. It's complete nonsense. Anything that increases your risk of 7 different cancers is not a health food. And the imaging work we see, it just prematurely ages the brain, it lowers blood flow to the brain. Marijuana, I'm about ready to publish a new study. Every area of the brain is lower in people who smoke pot. So should they make it legal? Of course. Don't put potheads in jail. That's just a dumb idea. But is it good medicine? I think we have to be very cautious. It's legal in 10 states for dementia, and I'm just not a fan. I have a sneaky suspicion that CBD is more like Xanax than people are admitting. Xanax is a benzo. And once you start it, it's really hard to stop it. And it affects your memory. But it's been legal for such a short period of time. We do not have big studies. And I'm going to probably do an imaging study on CBD oil because it's the most common question people ask me. Is it good for me? And I'm like, there are a whole bunch of things we know are good for you. This is not in that category yet. The M in Bright Minds is mental health issues, anxiety, depression, PTSD, chronic stress, all are hurtful to the brain. You should be on a smart program for your mind your whole life. We have a high school program that we do with kids called Brain Thrive by 25. The second I is infections and immune system problems. Major cause of mental health issues. The Journal of Alzheimer's Disease had a whole issue on infectious disease as a major cause of dementia. Lyme, herpes, CMV, toxoplasmosis, and so on. That's why you got to get your vitamin D up to protect your immune system. And get gut health, which I know we talk a lot about here at A4M. The N is neurohormone deficiencies. Very common, especially in people who've had head injuries and my NFL players. So getting your hormones optimized, I know that's part of A4M's mission. The D is diabetes, and I just couldn't be more horrified. I published 2 studies that showed as your weight goes up, the actual physical size and function of your brain goes down, which should scare the fat off anyone. And with 40% of Americans obese, it is the biggest brain drain in the history of the United States. So I coined the term the dinosaur syndrome, which is totally rude, and I almost regret I did that. But I was on a plane right after I published my second study, a small plane from Chicago to Des Moines with a woman that was 400 pounds. And so her body was in my seat. And I just had this thought, you should tell her she doesn't want to be a dinosaur, you know, big body, little brain. And the next thing that came in my mind was, shut your mouth. That is so rude. And, you know, I don't know if you had a mom like mine who said, if you don't have something good to say, don't say anything at all.
Yes, I did.
And when I got off the plane, I called my wife, Tana, and told her about the dinosaur syndrome, and she said, shut your mouth. You have enough people who hate you. Don't ever say that out loud. But 2 weeks later, I was at GNC. We were going to do some work together, the supplement company in Pittsburgh, and their marketing director was morbidly obese. And it pissed me off because I have this belief, if you don't live the message, you suck as a messenger.
Walk the talk, right.
And we're at dinner, and when I saw him order 2 souffles, and I'm like, when I'm at dinner, I'm thinking about what can I order to help me, not hurt me. And when I saw the 2, I'm like, Tom, you don't want to be a dinosaur. And my wife's with me. And why do women, in fact, you have pointy shoes on. Why do women wear pointy shoes? Because she kicked me under the table, and it hurt. But it engaged Tom, because he had no idea that as his weight went up, he was damaging his brain. And the next month, he lost 10 pounds. The next year, he was down 83 pounds because he didn't want to be a dinosaur. So I decided I'd talk about the dinosaur syndrome. And I've had people write to me, they've lost 200 pounds, 300 pounds, 400 pounds. I mean, it's phenomenal. Know the truth. The truth will set you free. The obesity epidemic in this country is the biggest brain drain we've ever had. And along with obesity comes diabetes. So that's what diabetes is. And according to JAMA, a new study in JAMA, 50% of the US population is diabetic or pre-diabetic. And I'm not okay with that. And you know, as blood sugar goes up, blood vessels become brittle and they're more likely to break, increasing your risk for hypertension and strokes, the blood flow stuff we talked about earlier. You need to get your blood sugar and weight under control. And you do that in large part by getting your diet right.
Okay, what's the S? I know you have a keynote to get to.
Sleep.
Okay.
60 million Americans have trouble with sleep. So sleep apnea makes your brain look like early Alzheimer's disease. Sleeping pills, not a good idea. Chronic insomnia can hurt the brain. You need 7 hours of sleep at night. And in our age of lights and gadgets and all these things that disrupt our sleep, we have to be much more thoughtful about it.
You're an extraordinary physician, a psychiatrist, world changer in your thought processes and what you're doing for medicine and for humanity. And I thank you so much. And I love this book. Thank you for signing that. And I look forward to your new book in November. And what is the name of that book?
It's called Feel Better Fast and Make It Last. So what are the things people do that help them feel better now, but not later, versus now and later? And there's a group of whole studies on single session therapy and how effective they can be. You don't have to sit on the psychiatrist's couch for a long time to feel well, but you have to know
one and done and
what are the habits I put in my life that serve me rather than hurt me. And here's the 3-second snippet to brain health. If you can ask yourself and answer it the right way, this one question every day, is what I'm going to do today good for my brain or bad for it? 3 seconds. You just have to answer it in the right way.
Look forward to that.
Thank you.
Thank you so much.
You're welcome.